So I think we've all known what public health is without actually knowing the term public health. And I think COVID-19 really put public health in the forefront. Advising on stay-at-home orders, working with our local health department and adhering to their guidance and doing the contact tracing and advising on using a mask. And now with the vaccination rollout, that is public health. I think the very core principle of the public health is caring about your community. And what we're seeing in public health is all of a sudden with COVID-19, people are really concerned about the safety of their parents, their friends, their kids. People want to do something about it.
So yeah, the ultimate goal is medical school, but as someone who grew up in rural Montana and has seen rural Montana, I want to come back and practice in rural Montana, and so I think that the MPH gives me a great tool set to be able to not only take care of patients, but to take care of the whole community. Something that we talk about a lot in public health are health disparities. And so, how someone's background or where they live or, any sort of environment that they're in might affect their health. That's something that I can keep in mind as a doctor someday.
So what got me interested in pursuing the field of public health was when I first started working in the hospital laboratory. I was on the night shift and seeing certain patients come in night after night with problems with addiction or suicidal ideation. Those repeat visits really got to me in that if they're coming to the ER every night with these problems, so that individual treatment isn't working and it's not addressing like the socioeconomic or cultural factors that are letting them down as far as their health goes. So public health takes more of an interest in that whole-minded community health. There's something missing in their community, in their personal life, that's not supporting their health in the way that they need.
So public health is really so broad, and that's what I like about public health. It's just not one discipline, it's actually multiple disciplines, and you're always working within a team, an interdisciplinary team of professionals. Here in Montana, we're seeing, forest fires. From an environmental health perspective, is how do you protect people from, being exposed to wood smoke? From a social behavioral sciences point of view, like what can you tell people so they'll stay indoors with a filtration unit? And then there's also the health policy end, and that's what types of policies should we be considering to reduce the impacts of climate change?
Logistically, the program is really nice because it does offer all online. If you work full-time or if you have family, is more inclusive to everybody who has different schedules and different responsibilities. It's also a great place if you love the outdoors. I think it's a place full of opportunity.
What I like most about Missoula is it's a really close-knit. Professors are very personable and approachable. I feel like they really know me even though I take all my classes online. It's like that community feel that Missoula has really translates into this program and the way that they care.
COVID-19 is a perfect example. In medicine, you're treating the patient, but really for public health, it's going upstream. and it's preventing diseases from happening to begin with. We're seeing a huge increase in interest in public health. We're seeing a huge increase in applications in our program. And it's all kind of coming back to, people want to do something. They want to protect the health of their communities.